Welcome everyone to today's webinar, COVID-19 Takes the Waiting Room Virtual, Patient Intake and Informed Consent for Telehealth. I am Laura Dierda with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your Q&A box that you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the link you used to log into today's webinar to access the recording. At this time, I am pleased to introduce our presenters. Teresa Moss is a Solution Marketing Manager at Interlace Health. Teresa has a background in hospital outpatient radiology and operations management. In her spare time, she enjoys cooking, gardening, and barbell training. Ann Hill is a Solution Architect at Interlace Health. Ann has 25+ years of experience designing healthcare solutions to solve complex clinical and administrative workflow challenges. She lives south of Boston with her husband and 3 children and enjoys boating, paddleboarding, and spending time at the beach. At this time, I am pleased to turn the floor over to Teresa to begin today's presentation.
Thank you so much, Laura. So I appreciate you all joining us today as we talk about this very timely subject. When the first coronavirus case was discovered in the United States earlier this year, a host of concerns from healthcare providers followed. Providing high quality care, keeping up to date on emerging information, and of course, reducing patient and staff exposure to the virus were of growing concern. The healthcare industry, historically slow to turn the ship and adopt new technologies, quickly pivoted to find solutions that kept patients physically out of healthcare buildings. Virtual collaboration, data tracking, and of course telehealth has stepped up to help address the virus and flatten the curve. The healthcare industry has seen an enormous increase in telehealth utilization. While it used to account for just 1% of care delivery, during the nationwide shutdown, 30% of all ambulatory care visits were conducted using telehealth. And federal health officials who had long placed technological and privacy restrictions on the delivery of telehealth services moved to empower providers to serve their patients wherever they might be. Before the pandemic, there were challenges around telehealth reimbursement. Payment was often at a lower rate than an in-person visit, and in some cases, payers would only reimburse for telehealth visits if the patient was located in an area underserved by medical professionals. Plus, each payer and each state had different regulations around how the patient could consent to the telehealth visit. In some areas, there were regulations requiring an informed consent be collected in person from the patient before the first telehealth visit could be offered. Luckily, we have a temporary and hopefully at least partially permanent relaxation of some of these barriers. And now that both providers and patients have had an incentive to use telehealth, we believe this method of care delivery is here to stay. As Seema Verma, Director of CMS, put it, the genie's out of the bottle on this one. It's taken this crisis to push us to a new frontier, but there is absolutely no going back. Now, coming along for this wild ride has been patient intake. Patient intake, of course, is the process we use to register a patient for their visit, collect insurance cards and photo IDs, and collect general consents from the patient like consent to bill and consent to treat. We also frequently collect information that's needed by clinical staff during this time, like health histories, signs and symptoms, medications and allergy lists, risk assessments, and the like. The days of handing every patient a pen and clipboard are behind us for a while. That tried and true process just doesn't fit anymore. It doesn't fit with a telehealth visit for obvious reasons, but it's not even a good fit for an in-person visit anymore. Both patients and staff are concerned about the potential for infection that passing items back and forth or having prolonged face-to-face conversations pose. But some things never change, or at least they haven't yet. We've still got to submit a claim in order to be reimbursed for those visits. In order to do that accurately and completely, we need to be able to collect demographic information from our patients. We need to look at insurance cards, driver's license, and other physical artifacts that a patient has. We need to collect our patient's health history in order to get a clear view of their situation. We need to know about their medications and allergies so that we can administer care safely. We still have the ethical obligation to gather consent from a patient, whether that be informed consent, where a treatment or procedure is explained to the patient, or just more general consent, such as consent to treat or consent to release information. And then, of course, we still need to be able to gather co-pays, co-insurance from our patients. All that presents a challenge during the telehealth visit. How can we make sure we're collecting all the information that helps us submit claims and deliver excellent care when the patient isn't physically with us? Now, most hospitals and health systems have an EHR, and some offer a patient portal that has options around remote intake. And while some of these offerings are more robust than others, there are still challenges. Patient portals often require an initial in-person visit to the provider so that the patient can be given a code to sign up. And given the amount of HIPAA-sensitive material that a patient portal serves up, this sort of requirement makes a lot of sense. But in a situation where a telehealth visit is a good fit for a new patient, how can they register for the visit if they can't use the patient portal? Also, many hospital services require specialized forms that help the providers understand the patient's situation and contribute to accurate documentation. Getting those forms served up to patients inside the patient portal can be difficult or impossible. They generally focus on gathering demographic information and stopping there. And then finally, often the EHR is delivering a one-size-fits-all solution. Have your own portal or app that you've developed for your health system and your patients are using, your own texting vendor, your own payment processor. The EHR usually wants to completely replace some of these, or is at least unlikely to offer much help when it comes to working with what you already have. So given all the changes in the way we deliver care, it's time to rethink our patient intake processes. Interlace Health offers a remote patient intake solution that can deliver all the intake steps you're currently using a mobile-friendly intake process. You can take your steps and deliver them to a patient for them to complete on their computer or mobile device. And the solution easily handles new patients. You can send us a scheduling message that contains information about the patient and appointment, and we use that logic to select all the correct intake steps for that particular patient. That includes filling out forms, taking a picture of driver's license and insurance card, payment processing, and links to external resources like outside content or educational material. This allows patients to complete all their steps prior to their visit, whether it be virtual or in person. We offer a highly configurable dashboard that your staff can use to monitor progress, make edits to form data and countersign if needed, as well as discrete data integration with your EHR, as well as sending a traditional looking version of your form to the EHR. Top that off with best-in-class services, custom configuration, and you have a highly tailored solution that works for you. I just want to switch gears for a moment from the patient intake topic to talk about how all those pieces enable other healthcare processes to happen virtually. In this case, remote informed consent. Our solution is flexible enough that we can help take processes that we've never been able to accomplish remotely and allow them to be accomplished in a telehealth setting. Imagine this scenario. Imagine a provider and patient are having a conversation about an upcoming procedure. Both provider and patient want to minimize any risks ahead of the procedure, so they agree that it makes sense to meet via telehealth. The provider explains the procedure as well as its risks, benefits, and alternatives, and the patient has a chance to ask questions. Once they fully understand, the patient consents to the procedure. They've just performed a remote informed consent. The only trouble is that we have to document that the consent took place. So to do this, we use a form that outlines all the information discussed. The patient signs it, and then the provider countersigns it. But how can this happen in a virtual setting? Well, using our solution, the form can be delivered to the patient's mobile device. They can sign it on their smartphone or tablet, and once they've submitted the signed copy, the provider can access the form via the dashboard and apply their own signature. The provider then archives it, sending the form back to the EHR and ensuring that it's available to the entire care team and will be in the right place at the right time on the day of the procedure. And delays caused by missing consents can be eliminated. So with that, I want to turn it over to my wonderful colleague, Ann Hill, who's going to take us through an overview of our solution in action. Ann?
Great. Thank you, Teresa. Just want to make sure you can all, Teresa, you can hear me okay?
We can.
Great. So during our conversation today, I'm going to show you how our remote patient intake solution really complements your current EHR environment. Leveraging Interlace Health's form and electronic signature capabilities outside of your organization's walls allows your staff to gather patient information ahead of the data service, just as Teresa mentioned, reducing wait times, avoiding those crowded waiting rooms, and supporting your organization's telehealth initiatives. So in this scenario, my patient, Mr. Allard, is scheduled for, let's say, an MRI appointment over the phone. And among the information collected or confirmed, if he's an existing patient at the time of scheduling, is his email address. And that scheduled appointment automatically triggers an email, such as the one you are seeing here, with a link that includes the correct forms or package of forms for that specific appointment to be presented to the patient when the site is accessed from the email link. As you can see here, I'm accessing email on an iPhone as the patient, but just note that this could really be on any type of device that the patient is using, whether it be a smartphone, a tablet, laptop, home computer, etc. So then, at a time that is convenient for him, Charles would access the email, click on the link in the email, and to sign in. If this was the first time that Mr. Allard was logging in, he would have been prompted to validate his identity with something like date of birth or, last 4 digits of social security number. But Mr. Allard will use the saved password he has on his device, and he is presented with a welcome message and taps the Go to Checklist button to access his checklist. So as I mentioned, Charles has an upcoming visit, an MRI exam, and several pre-registration items are waiting for him to complete. Items can either require input from the patient, such as a form or a signature, or could be reminder or informational type of items, such as directions or a link to a short video like you see on the bottom of the screen here, or even an opportunity to submit payment information. The due dates that you see here on the screen are automatically defined in relation to the date of the appointment. I'm going to go ahead and load the MRI exam history form by tapping the pen icon next to that form. The type of form that you see here has really been optimized toward a mobile solution, understanding that the majority of the time patients will be accessing their documents on a mobile device. So instead of presenting, an entire 8.5 by 11-inch form and trying to have the patient read that on a mobile device, we allow the data to really be chunked out in a way that's easily navigated by the patient, really contributing to a positive customer experience. And when completed, all of that data collected on this form will be mapped back onto that standard 8.5 by 11-inch type of form for archival to your EHR. You'll see here that some information is defaulting onto the form. So the pieces of information, collected at the time of scheduling or that are already on file in your EHR can default onto the form via an ADT HL7 message. So avoiding the patient having to, enter in their name, date of birth, etc. every time they are filling out paperwork. And then patient can also easily enter additional demographic information. And then using the next button at the bottom, patient can navigate through the form. Mr. Allard can easily answer simple medical history questions by toggling the yes/no button here. And notice on the diabetes question on the bottom here, if the patient responds no, they don't have diabetes, they are not prompted for additional information. However, if Charles said, yes, I have diabetes, he is prompted with some additional information pertaining to that diabetes. On paper, there are likely many fields or questions that just don't pertain to the patient. With an electronic solution, patient no longer has to be presented with that entire form with many questions that might not be relevant. Really streamlining the data input using conditional logic to only present relevant questions to the patient. Patient can also answer questions specific to the MRI appointment. Ask about his prior surgeries or if he's ever had any problems during an MRI exam. Patient can, in this particular form, patient has indicated that there is a pin in his left knee. And I'll show you in a moment how that information is relayed back to your staff members. Moving through the document, if the patient attempts to advance through the form without scrolling all the way to the bottom and therefore viewing all of the contents on the particular page, they will be presented with an error message that forces them to scroll to the bottom. So you really can be certain that patients aren't just rapidly scrolling through the form without reviewing all of the contents on each page. Using the click here to sign button, Mr. Allard can apply his signature to the document. Also has an opportunity to convert to a typed signature if necessary. And when this form is signed, a date and time stamp will automatically be included on the document image. And then that form image is submitted back to your admin panel, where it can be pushed through to the EMR, or it can go directly to the EMR depending on your particular setup. Moving on to the insurance card image upload item, I'm going to access that item. So patients can leverage the camera option of their mobile device or browse out to their device to include an image that might already be saved to their device to capture digital images. This can be used for things like driver's license, insurance card, maybe even an opportunity to take a picture of a prescription label on their pill bottle. So where it says click here to take a picture of the front, this is an insurance card example. I'm going to tap on the take photo. Patient can easily take a picture of the front and back of their insurance card. And there would be an opportunity, if they took the picture and it was blurry or didn't come out right, to go ahead and retake that image if needed. And then the digital image will be attached to the document when submitted back to your staff. Let's shift focus for a minute to your staff, your back-end experience. Administrative dashboards are available and customizable and really can be configured according to the needs of your users or groups of users. For example, patients can be sorted by things like location or reason for visit or modality. Here you're viewing a dashboard that has been configured to look at care events or appointments scheduled for this week. Maybe in reality, depending on the volume of your particular area, your staff may be just looking at what do I have today or what do I have today and tomorrow coming up. And your users can see the name of the patient in this particular dashboard, the name of the patient, the name of the care event or appointment, when it is scheduled, the status of the patient-facing items related to the event, and also any alerts that have been identified. From this particular dashboard, I can easily see that there is a clinical alert that was triggered off of one of the items that Mr. Allard submitted, and I'll show you what that looks like in a minute. I can also quickly and easily see where my patients are at with completing their forms. You'll notice Mr. Allard here on the top here is in progress, meaning he submitted some of his paperwork, but he hasn't submitted all of it yet. While others, you can see haven't started their paperwork or maybe even already completed all of their paperwork. So we've color-coded it to make it visually easy for your staff members to, have a quick look at the dashboard and, really get a gauge for the completion of forms for their particular patients. I also have the ability to drill in right from here into to obtain additional information about the packet of forms or the patient for that matter. You can see that the different statuses have been color-coded to quickly identify outstanding items. So those items in green have been completed, red, they are overdue, and those yellow are coming up due soon. I can also see from that clinical form alert on the previous page that Mr. Allard has indicated that there are an object or in his body or device in his body. So by Mr. Allard indicating on his form that there is a pin in his knee, it has triggered an alert, which then bubbled to the top of that dashboard. So now my staff can easily and quickly see that Mr. Allard has some metal in his body. He is coming in for an MRI, and I know that maybe now I need to reschedule that for a different machine. And I'm knowing that information well before Mr. Allard is standing in front of me, and I may lose, revenue on that machine, or I have to send the patient away if I can't accommodate a different type of appointment at that time. I can see that the MRI history exam form has been completed, and I have an opportunity right from the screen to drill in and see that form that the patient submitted. So this is the information that was mapped back to that standard looking form that Mr. Allard completed on his mobile device at home, in a parking lot while he was waiting for his wife in the grocery store, wherever that patient may have been. And I can see the signature that Mr. Allard applied. So let's say for a moment that I am the MRI technician reviewing this form with Mr. Allard. And I realize that, in talking with Mr. Allard, that maybe a response needs to be updated. Maybe he has had, some sort of a reaction before and he neglected to indicate that on this form. Your staff members can interact with these forms in a number of different ways. So as that MRI tech, I could use the clear signatures function at the top of the screen here to go ahead and clear Mr. Allard's signature out, make any modifications to the form that are needed, and then I can apply my name as the technician, my initials, and present the form to Mr. Allard to re-sign based on, after the modifications to the form were made. And as Teresa was mentioning, this may be the opportunity for that provider to, access the form and apply their counter signature to that consent form. And finally, just wanted to talk about options for when the patient does arrive to the facility. You see that not all of their forms have been completed. You can generate a patient-specific QR code that can be scanned to transfer that registration process to either a facility-owned tablet or device, so you can have the patient use their own device, right? So let's say patient comes in, walks up to the counter or lets you know that they're there, and you notice not all their forms have been completed. You can do a couple of things, right? You can say, oh, Mr. Allard, do you have your mobile phone? Do you still have that email we sent you? Oh, you do? Great. Can you go have a seat and access that email, access the link, complete those forms, and then, come back up and let me know when you're ready. Or Mr. Allard says, no, I don't have a device. You can use the patient QR code flow here to generate like I said, a patient-specific code to the screen here. I can then take maybe a facility-owned tablet, let's say an iPad, use the camera to scan that barcode, and have the forms load directly onto the device, hand the device to Mr. Allard. He can go then sit down, complete on that facility-owned device, and then bring it back up when he's done. Really giving your patients the opportunity to have the same experience, whether they are at home or whether they arrive to the office and have not completed all their forms. Oops, sorry, I went on with before you, Teresa, but that was all I had, Teresa, and I'll hit it back to you.
Okay, thank you so much, Anne. Great job. So, I want to just talk a little bit about why Interlace Health. Interlace Health offers a comprehensive platform to meet many of your digital needs, including bedside informed consent, downtime solutions, in addition to the remote patient intake and remote informed consent solution that we talked about today. We can help you transform your workflows by enabling seamless data capture and information exchange among your providers, staff, and patients. You can gain the efficiencies and overhead reductions without the expense or disruption of transitioning to a different EHR or adopting new software. Everything Interlace Health provides comes with perfectly seamless integration and customization, all within your existing systems. And Interlace Health has been around for nearly 28 years, and our customized solutions are at work in over 1,100 healthcare organizations, helping them reduce costs, accelerate revenue cycle, and improve the experience for patients and staff. So with that, I thank you for your time and attention, and let's get started with some questions.
Thank you, Teresa and Anne, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box that you see on your dashboard. We will try to get through as many questions as we have time for. We do have several questions already, so it should be a great discussion. The first question here is either Teresa and Anne, feel free to answer this one. Where does the dashboard live? Is it in the EHR or in a separate tool?
Sure, I can take that one,
I can take
Teresa.
that one. You go ahead.
Go ahead, Teresa. I'll let you.
Sorry. So it actually lives in, it's a browser-based dashboard, so it's not inside the EHR, but it can be displayed on your browser, on your workstation.
Perfect. And the next question is a similar logistical question we have here. How is the payment or card accepted in advance?
So we can either integrate with your payment processor if you already have one, or we can recommend a payment processor partner. In order to reduce our PCI scope, we link out to that payment processor. They actually can collect that credit card information directly so that we're not storing it inside of our systems.
Thank you for explaining that to us. The next question I have here is, what if the patient put in wrong information, and if the patient has a pin in his leg, or how would he put in the information, I guess, is the question.
Sure. And I get that. My background is in radiology, and so I totally understand the question. What typically is done is a review, right, with a technologist. And because our software allows editing of the information after its initial submission by the patient, we can still support that workflow, right? So the technologist can go through, verify the information with the patient, and if they've made some sort of mistake on their form, there's an opportunity for that to be corrected and then re-signed by the patient and countersigned by the technologist.
I see. And if the patient updates demo on the form, will this feedback go to the EHR?
Yep, so all the information we collect from the patient on the form can be sent to the EHR both as discrete data and as a traditional form image.
Got it. Thank you for explaining that. The next question I have here is, does this tool allow for integration that will allow automated consents based on the verification results posting schedule? And
yes.
For example, yes, go ahead.
Oh, go ahead.
I was going to say, the question went on to say,
the information.
My apologies, let's have a delay. I will let you continue with the response there.
I apologize. So I think the question was, are we able to automatically assign forms, consents, et cetera, based on information about the patient or their appointment? So if a patient is self-pay, you may want some particular form served to that patient that is different than if they have private insurance. Or if the patient is coming in for one type of visit, you may want a different form based on that visit type. And we can do that, right? So imagine, you know, on a paper-based process, the registrar would be building a little packet based on information about the visit or the patient. We can actually do this automatically with Logic. So we get a scheduling message from you. We analyze that message to decide which forms we're going to send to that patient or which steps we're going to send to the patient to fill out.
Great, thank you for that explanation. The next question is, does informed consent need to be obtained every telehealth visit or just once a year?
That depends a lot on your area. So there are 39 different districts have individual informed consent policies, and then the payers may have specific policies around telehealth consents, right? So it would really depend on your specific area, exactly what would be required. I will say that right now, these restrictions have been greatly relaxed in order to facilitate as much telehealth as we can provide. And I don't know in the future if they're going to be re-implemented, but for right now, it's not requiring as much consent as it did before the pandemic.
That's good to know. The next question I have here, do providers build their own forms, or does your database provide forms, and which forms are linked to certain types of appointments?
So we take your forms, right? So we take your forms and digitize them. We don't have right now a library of standard forms. We find that our customers have already done this work to get their forms approved and are not asking for their forms to be scratched and new ones to be brought in. So we take your forms, we put them in an electronic format, and then we also take that and put that in a mobile-friendly format to collect information from the patient.
Got it. And how is security of the patient handled with so many different types?
We do our platform is built on Salesforce, and Salesforce has a service called Shield that helps make sure that everything is fully HIPAA compliant and is encrypted at rest and all that kind of stuff. So it's all logging into the same platform regardless of your mobile device type, and so it has that same security regardless of what device you use to access it.
I see. That's helpful to know. And our next attendee question is, how are administrators or providers notified of clinical or administrative alerts? Do they get an email or do they have to constantly monitor the dashboard?
The alerts do display on the dashboard. They update in real time. So when they go to look at that patient, they can see right there on the dashboard that there is an alert. Click on it and find out more information.
Got it. The next attendee question we have is, what EHRs do you work with?
We are EHR agnostic, so we can work with any EHR. We have customers using a wide variety of EHRs, and so we are able to work with whatever you've got.
Good to know. Our next question is, does this require another login for patients and staff?
There is a login for the patient, for the staff. I'm sorry, the patient, we make it as easy as possible using like a two-factor authentication process so that they don't have to come up with a username and password. For security and HIPAA reasons, we do want staff to have an individual login so that we can keep track of who is looking at what information.
Got it. That's very helpful. The next question is the staff able to review the information patients have entered before it's added to the EHR?
Yeah, so we can send information using a CCD format, which a lot of times in most EHRs support reviewing that information before it's committed to the EHR. So that's one method. Another method is that they could look at the forms that the patient has filled out inside the dashboard and look at that as well before it's sent over to the EHR.
Got it. And this may be kind of looped into what you've discussed already, but we did have an attendee ask or mention that they have a Cerner EMR. How does all the information get into that medical record?
So we are able to use all the standard methods of sending discrete data, whether it be HL7, the Smart on Fire model. So we use just the communication standards that allow the systems to interoperate.
Got it. That's helpful. Another attendee wanted to know, do providers normally need training to be able to implement this tool in their clinic?
We do provide training. We strive to make it as easy to use as possible because we understand there's a lot of challenge around, turnover or, we just don't want a high learning curve on our software. So we make it as easy to use as possible. But we also provide training for staff who would use the software.
Got it. And how far in advance does an appointment need to be scheduled for the forms to get sent to the patients? This attendee is wanting to know if the information is sent from the EHR in a batch in advance or whether they receive real-time information from the EHR.
we send it out in real time. So if you schedule an appointment right now, like a patient who has a walk-in or something like that, that information or that form packet, that sort of digital packet is built and sent immediately to the patient. And we can also accommodate, so if a person has an appointment scheduled a year in advance and you don't want to send their forms to them a year in advance, but you'd rather it be, say, 5 days before their appointment, we can hold off on sending it as well.
I see. Good to know. The next attendee question here is, do you integrate with CRMs?
Yes, so again, we're built on Salesforce, so it's our own platform out on Salesforce, and so we have customers who are using Salesforce as well, and so yes, that's our basis is on Salesforce.
Got it. And then another attendee is asking, what types of devices does your software work on?
Because we're browser-based, we're pretty device independent, right? So, you know, your mobile devices, your desktop computers, laptops, all that stuff, we work with any browser that your device has. So we can be pretty broadly used across devices.
That's very helpful. Our next question is, are the forms placed into the EHR in the form of a scan or a photo?
So the forms go to the EHR, they're like a PDF. So they're just a form image, but the data that's on that form can also separately be sent as discrete data. So that way you have the data update that you want, but also have a form that looks familiar to you, and everything is in the place you expect it to be on the form.
Great, thank you so much. That's very helpful, and I appreciate your time here, Anna Teresa. Do you have any closing words before we finish up the webinar?
I just want to thank everybody for tuning in, and I want to thank you for the hard work that you're doing every day for our patients. I appreciate your time and attention.
Fantastic. Well, that is all the time we have for today. I know if there are any attendees with additional questions for Anna Teresa, feel free to reach out to Interlace Health and they will definitely be able to address them. I want to thank Teresa and Ann for their excellent presentation and Interlace Health for sponsoring today's webinar. Enjoy the rest of your day and we look forward to having you join us for future webinars.